Good afternoon, students, once again. So today we will be revising on the topic of superficial thrombophlebitis. We have already discussed about this topic, but still, we will just go through again on this topic. So this is the picture of superficial thrombophlebitis. Uh, this superficial thrombophlebitis, it is the abnormalities in the vein. Okay, superficial. So from the name itself, superficial. So in which part of the vein it will affect? Deep vein or superficial? Obviously, it will be superficial. It's not it. So it affects this superficial vein. So this is the superficial thrombophlebitis. So here in this area, inflammation occurs. This one is the blood clot, which occurs in the superficial vein. So this is the what to say? This is a picture for the superficial thrombophlebitis. Okay, so before starting like deeply in the superficial thrombophlebitis, so what do you understand if I say thrombophlebitis? So thrombophlebitis means it is an inflammation. Okay, which is it is an inflammation which cause what? Which cause blood clot. Which cause blood clot in like many parts of the vein, that is in the superficial vein, like it will occur there in many parts of the veins, and it usually occurs in your legs, in your leg area, and it affects this the vein that is under your skin, which is the superficial vein, and it also occurs in the deep vein, which is known as deep vein thrombosis, or else it's DVT. Okay, so thrombophlebitis means this. It is an inflammatory process. Means what happens here? Inflammation occurs. Inflammation. This is the inflammation. It occurs mostly in the legs portion. So this is the legs, and this superficial thrombophlebitis. It usually occurs in the legs, and this thrombophlebitis. It is the blood clot. So this is the blood clot. Okay, so thrombophlebitis occurs in two veins, that is superficial and deep vein. So this is the superficial one and this is the deep vein. So we will discuss mostly on this topic, that is the superficial veins, which is situated just under your skin. Okay, so this is in brief about thrombophlebitis. Is it clear? Yes or no?
Yes, ma'am. Yes,
Okay.
ma'am.
Okay, next is symptoms. So, what are the symptoms that you will find in superficial thrombophlebitis patients? So, you will find that the leg portion, that is the affected portion, which is this portion, it will be warm. Okay, means it will become a bit hot compared to the normal temperature. It will become a bit hot. It will become warm, and it will be tender. Tender means sensitive. Like if you will touch a little bit also, like the person will feel pain. Very much sensitive. Tender means young, sensitive. Okay, it means that. And it will pain in the affected area, that is the superficial vein, no? Means this portion it will pain, the affected area will pain, and it will be warm, like it will be a bit hot, and it will be very sensitive, which is in this area. And you will also find some redness. The color will change, the color of the leg will change, which will seem to be red in color. It's red in color, right? And since there is inflammation, it will appear as like red in color, which is means in your skin as well as in the vein, that is in the superficial vein. Okay, it will affect both of this, that is your skin as well as your vein. Okay, it will go along. since the vein is attached with your skin, right? That is the superficial vein. Since they are attached together, very close together, so it will affect their skin also. It will affect your skin also, and if it will affect your skin, the skin will also turn red in color. Is it clear? This symptom?
Yes.
Okay. Next is another symptom is pain in the limb. So the limb, this one leg portion, you will pain. And the next point is hardening of the vein. Hardening of the vein means what? The veins, you can see it, right? It will become hard. HARD means it will become, uh, yes, hard. The vein, like it won't, they won't seem to be normal, like soft. They will like they will be very hard. It will touch also. Like if you will just see also, like you will be able to know the difference. So it means that it will pain as well as the limb, no? Sorry, the vein, it will be hard. That is the superficial vein, it will be hard. Is it clear?
Yes, ma'am.
Okay. Okay, next is causes and risk factors. So what are the causes and risk factors that you will find in superficial thrombophlebitis patient? First is chronic health conditions. So who are at the risk of having this? Like who are like having health conditions, no? Like very much severe. So they are most likely to have this superficial thrombophlebitis. Next is medication. It might be because of some medications also. Next is immobility. Immobility means if a person will stay in one particular place for too long. So all those kind of people, they are most likely to have this superficial thrombophlebitis. Next is smoking, like doing all this tobacco and all that. No? All this, like they are at the risk of having this superficial thrombophlebitis. Next is obesity, like who are overweight people, na? They are most likely to have this superficial thrombophlebitis. Next is prevention. So how can you prevent yourself from not having or else from not getting this superficial thrombophlebitis? Take a walk. We should take a walk in order to prevent ourselves from this superficial thrombophlebitis. So if we take a walk, what will happen? Obviously, the blood circulation, it will be like rich. It will become like healthy type. So that's why uh, they should take a walk for this proper blood circulation. Next is in order to avoid the like thirst, no? Like dehydration, losing of fluids, loss of fluids and electrolytes in the body. So what they should do, they should drink plenty of water. Is it clear? So these are like few points on how to prevent themselves from not having this superficial thrombophlebitis. Is it clear, everyone?
Yes.
Okay, in risk factors, what you will find that you can also find in a woman, like say for example, who are pregnant, who are pregnant. Okay, and like and also you can find in a woman like who are pregnant or else who give birth, those also you can find. And like who are using too much of contraceptive pills, control pills, all those also they can have, they are at the risk of having this superficial thrombophlebitis. and also like who are using hormone replacement therapy, na? Like say for example all this transgender and all, they are most likely to have this, and a person who are elderly patient like say for example 60 plus and all that, and cancer patient like it comes under the chronic health conditions, all those. Is it clear? I hope it's clear.
Yes, ma'am.
Okay. Okay, if it is clear, then Vishal, Kalita, can you hear me? Vishal, Kalita, can you hear me?
Yes, ma'am.
Okay, Vishal, can you tell me what do you mean by thrombophlebitis? Thrombophlebitis का मतलब क्या है?
Uh, वो क्या है?
हाँ,
Thrombophlebitis. Sorry, ma'am.
हाँ, हाँ.
Uh, uh, inflow inflammatory process that causes blood clots.
Inflammatory process that causes blood clot, ना?
Yes, ma'am.
Yes? Okay. Okay, good. Yes, it is. ये एक
Thank you.
इन्फ्लेमेशन होता है पैर पे, पाँव पे, ठीक है? और क्या होता है? ब्लड क्लॉट होता है, मतलब ब्लड जमा होता है। तो उसके कारण क्या होगा? उसका कारण आ, उसकी वजह से क्या होगा? ब्लड अगर ब्लड क्लॉट हुआ है, ब्लड फ्लो अच्छी तरह से नहीं हो पाएगा जैसे पहले होता था, ठीक है? अच्छे से फ्लो नहीं कर पाएगा, तो इसकी वजह से ब्लड क्लॉट हो जाएगा और अल्टीमेटली इन्फ्लेमेशन होगा। इज इट क्लियर, विशाल?
Yes,
ओके. ओके देन नेक्स्ट, दर्शना.
Yes, ma'am.
ओके, कैन यू टेल मी सम ऑफ द सिम्टम्स?
Hardening of the vein,
हम्म.
thickening of the skin over the vein,
ओके.
redness and sweat,
ओके.
arm or tenderness, and pain in the affected area.
ओके. ओके, very good. So this one, it will become warm, not like the previous temperature, no? And it will become tender, means very much sensitive, which is the affected area, and there will be inflammation in the veins as well as in the skin. Since the skin and the vein, since the skin and the vein, they are like attached with each other, so it will affect these two areas. Okay, and then the limb will pain and veins will become hard. Okay, very good. Okay, next question goes to Divyajit. Divyajit, can you hear me? Hello, can you hear me, Divyajit? Okay, okay, it's okay. Next question goes to Jem. Jem, can you hear me? Jem Lulu. Okay, Ilashara. Hello, Ilashra, can you hear me? Hello.
Yes, ma'am.
Oh, Ilashra, can you tell me causes of superficial thrombophlebitis?
Issue, smoking,
Mm-hmm.
patients,
Mm-hmm.
quality,
Mm-hmm.
city,
Mm-hmm.
elderly people,
Mm-hmm.
sir patient,
Yes. Okay, good.
give
So,
birth.
okay. Okay, good. Okay, next question goes to long jump. Long jump. Can you hear me, long jump? Okay, moving on to the next, Malvina.
Yes, ma'am.
Malvina, can you tell me some of the risk factors?
Ma'am.
Can you please tell me?
Sitting for prolonged period,
Not parrot, period.
ma'am, prolonged period,
Not,
period,
period. Okay. And,
uh, overweight or obesity,
uh,
cancer patient, smoking,
uh, and,
person have varicose veins, which are common cause of superficial thrombophlebitis,
okay.
pregnancy.
Okay, pregnant woman, no?
Yes, ma'am.
Okay, anything else?
Using control piles, hormone
Piles?
replacement,
Can you please spell piles?
piles,
Control,
control
con,
piles.
can you please spell it, spelling?
Ma'am, pills, pills.
Piles, okay, not piles. Piles is different meaning.
Yes, ma'am. Mistake. Sorry, ma'am.
Okay, okay, no problem. Okay, control pills. Okay, and also hormonal replacement therapy. Okay, some people, what do they do? They uh, hormones. They used to replace some hormones. So all these kind of people also they are most likely to have the superficial thrombophlebitis. Okay,
Yes, ma'am.
okay, okay then. Okay then, good. Next question goes to Mercy.
Yes, ma'am.
Okay, Mercy, can you tell me how can we prevent ourselves from this superficial thrombophlebitis?
Ma'am, by taking a walk, to move the legs regularly, and to drink plenty of water or other non-alcoholic fluids to avoid dehydration in the body.
Hmm. Okay. If we take exercise or if we take a long walk and all, how does it help? How will it help us?
Ma'am, it helps in the proper circulation of blood.
Okay, very good. Okay, so in order to prevent ourselves, the best way is exercise. Understand? Like we should take a walk or else jogging. Means anything, but you should perform some exercise in order to prevent ourselves. Okay, so do you all take exercise? Yes or no? Srijana, Surajit and all. Do you take exercise? Nafisisha and all. Yes or no?
Or we
Yes,
prefer
Yes.
ma'am.
depend on mood, ma'am.
जब जब मूड होता है उस टाइम. How
Yes,
many hours?
ma'am.
How many hours or how many minutes or else second? Huh? How many hours do you take mostly, Surajit? Yes, 1 hour.
Hardly 50.
Hardly 15. Yes, Surajit, hardly
Yes, ma'am.
15 minutes only.
Yes, ma'am.
What about others? Yetulika and all, how many hours?
Yes, ma'am.
How many hours do you take exercise? Trishna and all, do you take?
Sometimes, ma'am. Not regular,
Sometimes.
like. Yes, ma'am.
Okay, that's sometime like how many hours? कितना घंटा लेते हो exercise?
It's not hard, like 15 or 30 minutes.
15 to 15 20 minutes is not even an exercise. No? Okay, at least you take. It's good. If you don't take exercise also, at least you do some activities, na? Like say for example dancing, all these things. Okay, it's good for your proper blood circulation also. If you'll just sit idly the whole day, it's not even good for your mental health also. It's not that you should refresh yourself from doing all these some extracurricular activities, right? So you should yeah, you should do all these kind of things. Okay, then that's all for today's class.